Hi, I'm Ashley Rubin. I'm a professor of sociology at the University of Hawaii at Manoa. I'm also a penal scientist. That means that I spend about half my time studying prisons and other types of punishment, and the other half teaching classes about prisons and punishment to college students. Today, I'm going to give you a crash course in the current coronavirus situation facing American prisons and jails.
The first thing to know is we have a very large population of people behind bars in prisons and jails. Prisons are places where people who have been convicted of relatively serious crimes have been sentenced to spend 1 year or more in confinement. By contrast, jails can hold a variety of people. Jails are places where people who have not been convicted await their court date. Jails are also where people who have been convicted of relatively minor crimes have been sentenced to spend less than 1 year in confinement. When we combine our prison and jail populations, we have about 2.2 million people behind bars. Our incarcerated population is the largest in the world. We refer to our massive reliance on prisons as mass incarceration to emphasize the way in which our incarceration rate is historically unprecedented and internationally unique. The increase in our prison population began in the 1970s and continued until about 2010. Since then, some state prison populations have increased and others have come down. Right now, we're not really sure what's going to happen next. The next thing to know is our incarceration rate does not reflect our crime rate. After a few decades of a really high crime rate, our crime rate came down in the 1990s and stayed pretty low, relatively speaking, but our incarceration rate continued to climb. Why the gap between our crime rate and the incarceration rate? Punishment scholars have demonstrated that the incarceration rate increased over time due to a variety of policy changes that sent more people to prison for longer periods and that reduced our traditional techniques for letting people out of prison. One consequence of mass incarceration, and especially the way in which we stopped letting people out of prison as we had done historically, is overcrowding. Overcrowding means we have more people in a given prison than the prison was designed to hold. Prisoners are often kept 2 or more in small cells. When we run out of cells, prisoners are in bunk beds in what used to be gymnasiums or hallways. Overcrowding has historically been a problem in our prisons, even going back to the very first prisons in this country in the 1790s. But it's an ongoing problem. Some facilities get it under control, and other facilities start to see an increase in overcrowding. At one point, 40 of the 50 states had prisons or prison systems under court orders to reduce overcrowding or overcrowding-related prison conditions that violated constitutional protections. Another consequence of mass incarceration, and to some extent where we have put all these new prisons over time, is inadequate healthcare. We don't have enough doctors, let alone good quality doctors, or enough resources to treat this number of people in prison, so there are often long waits for treatment even before COVID. Prisoners often have to do co-pays to get treatment, which many cannot afford. Our limited healthcare behind bars is especially challenging because of who is in prison. Our prisons house a large elderly population. Since we often send people to prison for 20, 30, 40 years or more, people grow old in prison. And since our prisons are not nice places, people grow old in prisons faster. Our prisons also house a lot of people with pre-existing health conditions. Poor people especially are disproportionately represented in prisons, and they also are more likely to have pre-existing health conditions in particular, in part because of their inability to access or afford health care. One thing to note about American prisons is the majority of our prison population, again meaning long-term sentence population, are people convicted of violent offenses. This often gets forgotten, as people sometimes try to stretch or confuse statistics about the increases in the prison population, or misunderstand the magnitude of major policy changes in the 1980s and 1990s. Part of the confusion also comes from looking at our federal prison population and not at the much larger state population. People often think prisons contain a lot more people convicted of drug offenses or other minor offenses. There are a lot of people in prison like that, but there are a lot more people who are in prison for more serious crimes. Each of these issues will have important consequences for the current coronavirus crisis behind bars and our response to it. So what is the current situation in prisons and jails during the worldwide coronavirus pandemic? The situation is not good. I'll talk first about the infection rate and then what we are doing about it. First, it is important to emphasize that there is a lot of variation across states and type of facility, jail or prison, state or federal. Some prisons are not testing a lot and some not at all. A few are only testing staff and not the prisoners. Information is also quite sketchy, as some facilities are not releasing information or enough information, but we can extrapolate from the facilities where we do have information. Here are some common findings. Prisons doing mass testing are finding large numbers of cases. That is, when prisons test their entire prison population, they are finding large numbers of cases. In some prisons, half or more of the prison population is infected. Second, routinely, we're finding that large numbers, 60, 80, or 90% of prisoners testing positive are asymptomatic. This is consistent with other numbers in free society, suggesting that we are not counting a majority of the cases. And keep in mind that even if you are asymptomatic, you can still have severe health consequences down the road, as we believe COVID-19 does permanent damage to our bodies. But of course, our knowledge is still limited about the long-term consequences of this terrible disease. But where we are doing wide-scale testing, a majority of the prison population is found to be infected, even if they are asymptomatic. And remember, many prisons are not testing widely or releasing their findings, so we are severely undercounting how many cases there are. But scholars and activists have been compiling the available data to give us a rough picture. The UCLA COVID Behind Bars project reported, as of May 16th, more than 9,000 confirmed cases among prison staff across the country. More than 29,000 confirmed cases among incarcerated people across the country. 38 confirmed staff deaths and 415 confirmed prisoner deaths. However, these numbers are based on incomplete data. For example, they do not include cases from Arizona, Colorado, Connecticut, Hawaii, Idaho. I'm going alphabetically, but you get the idea. A lot of states are not releasing their information. Another insight we can get comes from the New York Times, which is tracking clusters across the country. Clusters refer to situations in which many cases are linked to one business or agency or organization. The list is almost entirely correctional facilities and elder care facilities. As of May 14th, the 3 biggest clusters in the nation were from correctional facilities, and 6 of the top 10 were correctional facilities. Some prison towns, meaning towns with 1 or more prisons in them, have become some of our biggest epicenters in the country. Prison guards are getting sick and/or bringing the disease into their community and families from the prisons. So even if the town is social distancing and the prison is effectively closed off, the disease can spread from the prison to the town. Additionally, in some situations, prisoners are being transferred to local hospitals, and the cases from the prisons are overwhelming the local hospitals, depleting already limited resources from the free population. Why is the coronavirus situation so bad in U.S. prisons? In most places, prisoners are forbidden access to basic hygiene measures. They cannot wear masks, they do not have enough soap, they are not allowed to use hand sanitizer. These are things that you and I use on a regular basis to protect ourselves from getting infected, but incarcerated people are prohibited from using them. Keep in mind that a number of incarcerated people are also making masks and hand sanitizer that then get distributed to other people. But it's not just the lack of hygiene products that are making prisons dangerous for the people who live and work inside them. Remember, many of our prisons are overcrowded, so prisoners are sharing cells or are in bunk beds in gymnasiums. Social distancing is impossible except in solitary confinement, which we should not advocate as a safety measure because solitary has its own mental and physical health consequences. As I mentioned already, healthcare in prisons is frequently inadequate, and our prison population includes large populations of people with pre-existing conditions as well as a fairly large elderly population because of the lengthy sentences they receive. Together, these conditions make prisons very dangerous places for the spread of the coronavirus. So what are prison and jail officials doing to prevent the spread of coronavirus? Overall, not enough is being done, and we are moving too slowly. One of the first changes, however, was to stop visits to incarcerated people from their family and friends. This makes a lot of sense, but unfortunately, it also has major consequences for the rehabilitation and reentry prospects of incarcerated people. Moreover, unlike many European countries, many American prisons are not replacing in-person visits with free virtual visits. Keep in mind that phone calls to or from incarcerated people are incredibly expensive. However, props should go to the federal government, which did make calls and videos available for free. The most important strategy for preventing the spread of coronavirus is to massively reduce the incarcerated population. Currently, we are not releasing enough people to really make a difference nationwide, although some jails and prisons have released a large portion of their populations. According to the UCLA COVID Behind Bars project, we have some release numbers from cooperating facilities, but this is a tiny fraction of all correctional facilities in the United States. Of the 147,000 people in jails when this started, 42,000 have been released. Of the 620,000 people in prisons when this started, 24,000 have been released. That's less than 4% of our prison population. But that's not enough. And obviously, we have way more than 620,000 people in prison. So remember the underreporting here. This is only referring to the people in prisons that are reporting to the COVID Behind Bars project. Here are some specific strategies we are using to reduce the incarceration rate and that can be used on a wider scale than is currently being used. First, $0 bail. Many people in jail are there because they cannot afford to pay their bail. They have not been convicted or even tried, and they have to stay in jail until they get their trial. In some cases, when states and cities went into lockdown, some courts closed or heard fewer cases, leaving people in jail to wait even longer. By reducing the cost of bail to nothing, we've been able to empty some jails of people awaiting trial. This is something happening in some California cities, for example. Another strategy is to release people who are near the end of their sentences. The idea here is they have served most of their sentence, so releasing them should not be too objectionable to people worried about someone getting off easy. Likewise, some facilities are releasing people with pre-existing conditions or who are elderly, regardless of their crime. Here, the idea is these groups are more likely to die of coronavirus, and it's a moral necessity to prevent that from happening. Additionally, particularly the elderly are at a much lower risk of recidivating, that is, of committing crime once they are released. The thing is, these strategies are part of the reason why we've only released less than 4% of the prison population. It's not something that a lot of policymakers want to hear, but many scholars and advocates are pointing out that we need to release people convicted of violent crimes. A lot of the research, as well as natural experiments, show that people convicted of violent offenses are no more likely to recidivate than people convicted of nonviolent offenses. This means people convicted of violent offenses can be safely released. How is that possible, since it really seems to go against common sense? There are a few reasons, but here are the two that are the most straightforward to understand. First, a lot of people who are convicted of violent crimes spend a really long time in prison, much longer than is needed, because most people age out of crime starting in their 20s. By the time someone is in their 30s or 40s, their crime committing years are usually behind them. But a lot of people convicted of violent offenses stay in prison even longer than that. The second reason is that the designation of who is a violent offender and who is a nonviolent offender is kind of meaningless. It's more accurate to distinguish between people who are convicted of a violent offense and people who are convicted of a nonviolent offense. Why the distinction? What someone gets convicted of usually has more to do with the plea bargaining process and the norms of a local court than the actual behavior of the person convicted of crime. Additionally, there is little correlation between how violent a person is and what they are convicted of, if they are even convicted. For these reasons, scholars and advocates are calling for much bigger releases from prison, closer to 50% or more of the prison population. But we're not seeing much movement on this, except in a few jails. So that's the situation in our prisons before and during the coronavirus situation. To close, I have some thoughts about how we can navigate different policy proposals and our personal preferences. Generally, we can think about prison policy through a humanitarian perspective, that is, thinking about the welfare of people in prison and their families. Or we can think about it from a self-interested perspective, thinking about your own welfare and the welfare of your family, assuming you see yourself and your family as different from people in prison. In the United States, policy change is more often motivated by a self-interested perspective, but a growing number of people are also motivated by the humanitarian perspective, so let me address both briefly. If we do not move more quickly, really quickly, our prisons will become death traps. The prison population is one of the most vulnerable populations in our society. We have a very large prison population, and given how fast coronavirus can spread in a prison and how vulnerable that prison population is, a very large number of incarcerated people will die if we do not do a better job preventing the spread of coronavirus. You may know that we still have the death penalty in the United States, even though almost all of our peer countries have abolished it. We execute a couple dozen people per year. At this point, more prisoners have died of COVID-19 than by executions in the last decade. It's also important to realize that this is not only a humanitarian crisis for the people living and working behind bars, but it also puts the rest of us in jeopardy. Those of us who are unlikely to ever be incarcerated ourselves are at risk from COVID behind bars. There is no legal or humane way to fully insulate society from prisons, and the disease will continue to spread from prisons through correctional staff and other mechanisms into communities, even those that remain properly locked down and engaged in social distancing. So whether we're thinking about this from a humanitarian perspective or a self-interested perspective, we really need to do more to make our prisons safer during the coronavirus pandemic. Again, I'm Ashley Rubin. Thank you for listening to this video and getting up to speed on the coronavirus situation in American prisons and jails.